Alright, so in the last video I went over some risk stratifications, and now I'm continuing that with the rest of the risk stratifications. The last video is mainly about the first 5 risk stratifications, which are kind of more lifestyle oriented. These next 3, you pretty much need a medical test to find out if you have a risk factor in that category. Medical. So, first category out of the 3 is hypertension. This means if you have a systolic blood pressure of greater than or equal to 140 millimeters of mercury, or a diastolic blood pressure of greater than or equal to 90, that will give you a risk stratification. Or if you're on prehypertensive or hypertensive medications or whatever, right? So remember these numbers, 140 and 90. Moving down to dyslipidemia. Basically, LDL, low density lipoprotein. If you have an LDL count of greater than 130, then that's a risk stratification. HDL count of less than 40, risk stratification. Or if your total cholesterol is greater than or equal to 200, you would have a risk stratification. That doesn't mean that you would have 3 risk stratifications if you have each of these, though. That just means if you have any one of these, or a combination of them, you could have all of them. If it's all in one category, you still only get 1 risk point added. So, the next category is prediabetes. There's 2 things that you look for. There's impaired fasting glucose, okay, IFG, and then oral glucose tolerance test, OGTT. For IFG, if it is between 100 and 125, that's an indicator. Or on the OGTT, if it's between 140 and 199, that's also something that can give you a risk stratification point. So, those are the 3 risk stratifications that we were going over, and then there's 1 negative risk stratification that I'm going to go over. It's a negative risk stratification because if you get a check in that category, it's not a +1, it's a -1 to your score. So that means that if you have a high density lipoprotein count of greater than or equal to 60, you get +1. Up here in dyslipidemia, we said if your HDL is less than 40, you would have, that would be a risk factor that you would have to add a point onto. Here, HDL greater than or equal to 60, you can subtract a point from your overall score. That would be -1. Also, one other thing that I want to add in here is that a lot of people don't know all their scores when they come in and get to start filling out a PAR-Q and going over risk stratifications with you and everything. So if your client doesn't know the answer to prediabetes, they don't know what their impaired fasting glucose is or their oral glucose tolerance test, you can find out you can basically find out that they would get a point for that category if they have a BMI of greater than or equal to 25, or they meet the criteria for the age risk factor. So if there's a check in the age category, then you put a check in the prediabetes category if you don't know their numbers. And that is risk stratifications. Next video we'll go over risk classifications, so it's basically how to apply these.